The majority of the world's people now live in urban areas. In the UK, it's much higher at around 83%. Those of us who do, and especially those in the most deprived areas, are at risk of poor health from a wide range of factors. And these factors contribute substantially to the rise of non-communicable diseases, NCDs for short. An estimated 80% of UK deaths are now caused by NCDs, most of which are considered preventable. As a result, the prevention of NCDs is now a key government objective. This should be able to save our NHS, but there's no silver bullet. Countering NCDs is complex and requires many wide-ranging changes to decisions made far upstream. For the last 5 years, our team of researchers have been investigating and bringing to light a complex web of issues and possible solutions. As well as engaging with those suffering from unhealthy urban environments, we've explored the issues with public, private, and third sector stakeholders at every level. Our research highlights the many and varied barriers to overcome. A critical obstacle, for example, is systemic short-termism. Our short political and financial timeframes consistently devalue future costs and benefits. Another is the failure to prioritize prevention across all tiers of decision-making, across both public and private sector. Strongly linked to this is the way we value things and then make decisions based on that valuation, decisions which leave us extremely vulnerable to shocks like COVID. Decision makers need both the evidence and the tools to be able to prevent the massive long-term costs of not addressing the barriers we've identified. To that end, we developed and tested 7 areas of intervention, focusing on government appraisal guidance, prioritizing health with private sector professionals, real estate investment, city-region transport strategy, spatial planning, local government legal capacity, and public engagement. Central to several of these has been the development of a new valuation model that quantifies the likely health outcomes from different types of urban development. This has been tested on major developments and is now due to be included by the Ministry of Housing, Communities and Local Governments in their appraisal guide. This research does not provide all the answers by any means, but it does provide decision makers with robust new evidence and tools to help them prioritize health. It is also a much-needed step towards taking public health priorities further upstream. More work is needed by all sectors, with government and communities taking the lead, but allowing the private sector to do what it does best. We can all play our part in improving life for people in urban areas.